So my presentation is on ear, nose, throat, and ophthalmological conditions. For the ear, nose, and throat, obviously consists of the external, middle, and inner ear, and for the nose, you can see right there. Sinusitis, or acute sinusitis, chronic hyperplastic. It's an inflammation of the sinuses. Acute has symptoms lasting 2 to 8 weeks. Chronic has symptoms lasting longer than 8 weeks. And chronic hyperplastic is a form of chronic sinusitis characterized by polyps in the nose and the sinuses. It's caused by allergies, pollutants, bacteria, fungal, and viral. May also be, you also might get it after a cold. Signs and symptoms: congestion, cough, fatigue, fever, headache, post-nasal drip, and weakness. And for management or treatment, you would have nasal decongestions, analgesics. You would have nasal spray. For acute cases, it's usually antibiotics. For chronic cases, it may require surgery to improve the drainage within your nose. And for chronic hyperplastic sinusitis, they will surgically remove the polyps within your nose. Allergic rhinitis, or hay fever, pollinosis, it's just, if you think of it just as seasonal allergies, inflammation of the nasal mucosa due to allergic reaction. Causes are usually environmental triggers: pollen, grass, ragweed, or animal dander, dust, and mold. It's dependent on the concentration, whether it's hot, windy, or warmer outside. Signs and symptoms: nasal congestion, impaired sense of smell, itchy eyes, nose, mouth, or throat, lacrimation or secretion of tears, nasal discharge, nasal drip, sore throat, sneezing, and suborbital swelling. Management: just try to avoid it, basically. Nasal flush using saline, oral antihistamines or oral or nasal decongestants, nasal corticosteroids, and immunotherapy for persistent symptoms. Benign paroxysmal positional vertigo, or BPPV, or canalithiasis. It's an inner ear disorder characterized by mild to severe short-term vertigo associated with changes in head position, caused by rapid changes in head position, caused by otolith crystals from the vestibule of the inner ear to the semicircular canals. It's usually unknown cause, or it has a cause as trauma or infection. Signs and symptoms: dizziness, blurred vision, lightheadedness, loss of balance, nausea, nystagmus, unsteadiness, and vomiting is also rare. And then some management or treatment is Epley maneuver, which just might eliminate the symptoms a little bit. Surgery for severe cases, and then a video.
I'm Scott Hanna, founder and president of Quick Medical. I started Quick Medical back in
Hi, I'm Tim. I'm a physical therapist. I'm going to show you Brandt Daroff habituation exercises for treatment of positional vertigo. Your therapist has identified one ear or the other, inner ear, as the source of your dizzy symptoms. This treatment is for the home after your therapist has administered the Canalith repositioning techniques, or Epley's maneuver in the clinic. If they've identified the right inner ear as being the source of your symptoms, sitting on your couch or your bed, you'll turn your head to the left, you'll lay down on your right side. You may notice symptoms at this point, the dizziness, the perhaps nausea. Wait, it may take up to 30 seconds. Wait for the symptoms to subside. Once they do get better, sit up, turn your head back to the starting position, reverse the procedure, and repeat repeat it on the other side. Okay? Still looking up. You may notice symptoms again at this point. Wait. Let the symptoms get better. It may take up to 30 seconds. Okay? Once the symptoms are better, sit up. Okay? Brandt-Daroff repositioning or habituation techniques. That was for the treatment if the therapist.
So that's an at-home treatment for vertigo. Labyrinthitis, or many ears disease, otitis interna, otitis labyrinthica. It's irritation and inflammation of the inner ear, usually following ear or upper respiratory infection. Causes can be excessive alcohol consumption, history of allergies, recent ear or respiratory infection, viral illness, smoking, stress, and use of specific medications. Management and treatment, for acute attacks, bed rest. Symptoms can be treated with antihistamines, and last case scenario would be surgery. Otitis externa, or outer ear infection, or swimmer's ear, is an infection of the oral canal, most commonly caused by bacteria, can also be caused by fungal infections or chemical irritations such as cosmetic sprays or dyes. Those that are affected by allergies, eczema, psoriasis, or scalp dermatitis are at higher risk for otitis externa. Otitis externa, signs and symptoms are itching, pain in the ear, discharge, which would be odorous, white or yellow, and swelling of the oral canal. Management would be removal of the infected material within the canal, obviously. Vinegar ear drops to aid in the restoration of acidity, and corticosteroid drops to decrease the inflammation. And for moderate to severe would be antibiotics, and acetaminophen can be used for pain. Otitis media is an infection of the middle ear. It's classified as acute, chronic, or secretory. If you're less than 2 years old, you're at risk for acute otitis media. It's usually caused by a bacterial or viral infection. Also, if you have a respiratory infection, secondhand smoke, and allergies, you're at risk for acute kind. For chronic, infection is caused by eardrum perforation or cloasma. And for secretory otitis media, accumulation of fluid in the middle ear, commonly caused by blockage in the eustachian tube. And for treatment for the chronic one, the secretory one, they would put basically a hole in your ear surgically to have that fluid drain out. Signs and symptoms would be discharge from oral canal, fever, headache, hearing loss, history of recent upper respiratory infection, lethargy or lack of energy and enthusiasm, pain in the ear or sensation of fullness within the ear, which is one of the giveaways for it. Other treatments for acute and secretory would be acetaminophen, NSAIDs, and antibiotics. For severe, like I said, a myringotomy for surgical opening made in the tympanic membrane. Also for chronic otitis media, cleaning and application of the acetic acid, hydrocortisone, or antibiotic eardrops. They also may force ear past the blockage in the eustachian tube by attempting to exhale with the mouth shut and the nose pinched like this. Good. Ruptured tympanic membrane or eardrum perforation is a hole in the tympanic membrane. It can be caused by otitis media is the most common cause, or sudden change in atmospheric pressure, like a slap to the ear, or damage by a foreign object, usually like a Q-tip. Signs and symptoms: sudden severe ear pain, bleeding from the ear, drainage of pus from the ear, hearing loss, tinnitus, vertigo. Management or treatment would be you'd be inspected by an otoscope. It would typically heal without treatment. Antibiotics prescribed if infection is present, and surgery if not healed after 2 months. Tinnitus or ringing or buzzing or hissing, originating in the ear, not a disease, but a symptom caused by several other conditions. So some of those could be otitis media, labyrinthitis, impacted serum, ruptured tympanic membrane, loud noises, explosions, reaction to certain medications. Signs and symptoms, once again, ringing, buzzing, hissing. They may be pronounced in quiet environments. To manage it would be just to have background noise or music to aid in the toleration, and for chronic or severe, hearing aids or cochlear implants would be used. Tonsillitis or acute tonsillitis, follicular tonsillitis, or acute parenchymatous tonsillitis. It's inflammation of the tonsils, which is the lymphoid tissue, blah, blah, blah. Causes would be viral infection, which is the most common, and then streptococcal is the second common one. Signs and symptoms, they would appear large and red. Viral infection, for the viral infection kind, throat pain, cough, fever, rhinorrhea, or diarrhea. Streptococcal infection, fever, headache, nausea, vomiting, and swollen cervical lymph nodes, so just a little bit different. Symptom management, antibiotics for the bacterial one. For chronic, just remove them. And for untreated streptococcal infection, they can lead to rheumatic fever and heart valve damage as well. And then on to ophthalmologic conditions. Chalazion, chronic granulomatous inflammation of a meibomian gland of the eyelid. Signs and symptoms, discomfort in the eyelid, redness and lump on the inner surface of the eyelid, which is key to the inner surface of the eyelid. Vision may be distorted if it's large enough to press on the cornea. For management or treatment, warm compression or local incision to remove the chalazion would be required. Hordeolum, or a stye, it's infection of the sebaceous glands of the eyelid, usually caused by staph. Signs and symptoms, pains, redness, swelling, warmth. Same thing as chalazion basically. It would be warm compression and maybe an incision or drainage would be required to treat it. And BLEPHARITIS, it's an inflammation or infection of the eyelid's margins. Same thing, almost. It's just a little bit different because it's got crusting and small ulcerative lesions and dry scaling along the eyelashes, and some of the eyelashes may fall out. Seborrheic blepharitis has oil scaling, usually associated with seborrhea of the scalp. And to treat that would be topical antibiotic ointment. And for the seborrheic blepharitis, you would have gentle massage of the eyelid margin with some baby shampoo. And in the top left is a chalazion, and top right is hordeolum, and the middle is blepharitis. So blepharitis, you can see some crusting, yellow stuff. And the hordeolum, or the stye, is the sebaceous glands, and then chalazion, it's not the, they look the same as the stye, but it's a little bit lower. It's not the actual sebaceous glands. Conjunctivitis, or pink eye, is inflammation of the conjunctiva. Causes can be viral, bacterial, allergy, chemical exposure, or infection that is, and it's easily passed from one person to another. Signs and symptoms: itching, burning, red eye, discharge. For the discharge, it's different for each one. For viral, it's watery discharge. For bacterial, it's purulent. And for allergic discharge, it's thin and stringy. Another sign would be a sensation of having something within your eye. Your eyelids may be swollen and stuck together upon waking. And it's also associated with an upper respiratory infection and pre-auricular adenopathy. Management and treatment: viral is self-limiting and treated symptomatically, so you're just treating symptoms. Bacterial, antibiotic drops or ointment. And for allergy, just antihistamine drops. Chemical offending agent should be removed, obviously. Myopia, which is nearsightedness, difficulty seeing far objects, ability to see near objects clearly, signs and symptoms, headache and eye squinting when looking at objects in the distance. Management or treatment, glass and contact lenses, and refractive surgery, laser assisted in situ keratomyeliosis, or just LASIK surgery. And then hyperopia is farsightedness, difficulty seeing objects near you, but you're able to see objects far away from you. It could be caused by light rays are focused behind the retina due to irregular shape of the cornea. Management and treatment, once again, same thing, glasses or contact lenses, and LASIK surgery. Astigmatism is partial blurring of an image at any distance. The cornea is just oddly shaped. Signs and symptoms, headache and eye strain. Management is corrective lenses. And glaucoma, actually a video for this.
Glaucoma is a group of eye diseases in which the optic nerve is damaged, leading to irreversible loss of vision. In most cases, this damage is due to an increased pressure within the eye. The eye produces a fluid called aqueous humor, which is secreted by the ciliary body into the posterior chamber, a space between the iris and the lens. It then flows through the pupil into the anterior chamber between the iris and the cornea. From here, it drains through a sponge-like structure located at the base of the iris called the trabecular meshwork and leaves the eye. In a healthy eye, the rate of secretion balances the rate of drainage. In people with glaucoma, the drainage canal is partially or completely blocked. Fluid builds up in the chambers, and this increases pressure within the eye. The pressure drives the lens back and presses on the vitreous body, which in turn compresses and damages the blood vessels and nerve fibers running at the back of the eye. These damaged nerve fibers result in patches of vision loss, and if left untreated, may lead to total blindness. There are two main types of glaucoma: open angle and angle closure. Open angle glaucoma, or chronic glaucoma, is caused by partial blockage of the drainage canal. The angle between the cornea and the iris is open, meaning the entrance to the drain is clear, but the flow of aqueous humor is somewhat slow. The pressure builds up gradually in the eye over a long period of time. Symptoms appear gradually, starting from peripheral vision loss, and may go on unnoticed until the central vision is affected. Progression of glaucoma can be stopped with medical treatments, but part of the vision that is already lost cannot be restored. This is why it's very important to detect signs of glaucoma early with regular eye exams. Angle closure glaucoma, or acute glaucoma, is caused by a sudden and complete blockage of aqueous humor drainage. The pressure within the eye rises rapidly and may lead to total vision loss quickly. Certain anatomical features of the eye, such as narrow drainage angle, shallow anterior chamber, thin and droopy iris, make it easier to develop acute glaucoma. Typically, this happens when the pupil is dilated and the lens is stuck to the back of the iris. This prevents the aqueous humor from flowing through the pupil into the anterior chamber. Accumulation of fluid in the posterior chamber presses on the iris, causing it to bulge outward, and block the drainage angle completely. Acute angle closure glaucoma is a medical emergency and requires immediate attention.
So there is two different types of glaucoma, open angle and angle closure, which they just talked about, and I thought I explained it much better than I could have. It's a condition of the eye in which increased intraocular pressure causes damage to the optic nerve. If left untreated, permanent vision loss can develop. Open angle glaucoma, typically asymptomatic in the early stages. Ophthalmologic examination will reveal changes, so someone should get a check, routine check, eye screening every 2 to 4 years for individuals over 40, every 1 to 2 years after 65, and for open angle, topical agents and laser and surgery may be required. And once again, acute angle closure glaucoma is a medical emergency. Also, medications, laser therapy, and surgery would be done afterwards. And then questions that you guys can answer on your own. Good. Done. Am I still just standing here like an idiot?